One and hi everyone. Oh, we're live. Hi everyone. Welcome to Wonder Series. This is Wonder Series Wednesday. I am Denise Stegall, the CEO and curator here at Living Healthy List and your host of the Wonder Series. We're here every week to answer those questions that you have, whether it's about your health, overall wellness, personal development, or bringing some fun back into life. You know, those burning questions that have been kind of niggling in your brain, but you've either just never asked or you're too afraid to ask. Maybe you thought you should know the answers. But let's be honest, we are not born knowing everything. And luckily, we don't have to because we have an amazing group of experts every week who can answer the questions that we have and really help us to elevate our life, to bring things to that next level and to basically live that healthy, happy lifestyle that we have been all searching for. So today I'm really excited to talk to Dr. Emily Kirkwold, and Emily is a pharmacist. Okay, she's also a natural family planning educator. She empowers women to care for and love their bodies through teaching them how to track their cycles and use that information for their own health and or family planning. Dr. Emily lives up in the Twin Cities in Minnesota, not too far from where I am, with her wonderful husband and her two kiddos. And Emily, hi.
Hello. Thank you
Thank
so
you
much
so
for
much for
having me.
being here.
Oh, I'm so excited.
Me too, me too. So tell us a little bit. You're a pharmacist, but you're a natural family planner. How does that work?
Right? Well, I am a pharmacist by background, and I'm very proud to be a pharmacist. But one of the most important jobs that pharmacists have is to identify when people do not need medication. And so I take that role seriously when it comes to women's health. And so I teach women their options for family planning. So, yes, I do know about medication hormonal options, but I also teach women about natural family planning methods. So, I teach them how to track their cycles and use that information, just like you read in my bio, for health or family planning. I teach online classes and I work one-on-one with women and or couples virtually.
What does that all entail? Like natural family planning. I have one thing in my mind, but I'm sure there's a lot more involved. So please delve into that. Tell us more about what natural family planning is and why it's important.
Yeah. There are a lot of myths out there about natural family planning, and the term itself can be a little bit confusing. If you search natural family planning in the Webster Dictionary, it will tell you it's a method of birth control by paying attention to your body's symptoms. How I like to describe natural family planning is it's teaching women to learn their body's natural signs of fertility, to keep track of those signs, and then to use that information to either monitor their overall health or to avoid a pregnancy effectively and naturally, or to achieve a pregnancy. And it is really important, even if you're not at a point in your life where you're thinking about family planning, for girls and women to know their cycles.
Mhm.
The American College of Obstetrics and Gynecology, or ACOG, has called our menstrual cycles the fifth vital sign. The information is that useful, and it's not just knowing when the bleeding of your period comes.
Yeah, there's a lot more involved there. And I think I know for example, growing up, I didn't really know anything. And as I've gotten older, obviously I've learned a little bit more and understood a little bit more. But I think the cycle piece is really, I think it's confusing.
Yeah, it definitely can be. It definitely can be. And especially when we're just kind of told, at least I was told as a girl, okay, your period's going to come. You have to figure out how to manage your period and then just kind of wait until the next one comes. You might have some symptoms, like just kind of deal with those. Like it's kind of like this is something that happens to you and you just have to deal with it.
Yeah, that's kind of what I remember too. And I think, I wasn't too young. I was probably 12, but for a 12-year-old, that's intense.
Yeah, definitely. And unfortunately, I don't think that there's enough people talking to girls and women about why we have cycles and what this information means for our body beyond that bleeding of a period.
Mm-hmm.
And so
You
that's what I'm
mentioned,
really passionate about teaching.
yeah, it's so important. And, it's funny, you mentioned ACOG, and I remember back in the day when I worked for a pharmaceutical company for a short period of time, I was actually at one of their conferences. And what I found with going to the gynecologist was the information that they had for me was very vague.
Yeah, it is. And unfortunately, physicians have a lot to learn in medical school, right? And the female body is complex. And yeah, the way that, medical school training is, but also how our traditional medical system is, OBGYNs have a very short window of time with a patient. So it's really, okay, here's, a little bit of information as quick as possible to get you what you need and get you on your way.
Sounds about right. So how do we kind of recommit, since we've been talking about recommitment this month, how do we recommit to our health and that natural planning, whether you said, like, whether it's to achieve a pregnancy or to prevent a pregnancy? What's our first step? What do we need to know?
Yeah. I love to talk about how natural family planning can be a great tool for us as women to know our bodies better. And so the first step is really knowing what are the signs that your body is already giving you
Mm-hmm.
about your fertility and about where you're at in your cycle. So, one of the main signs that I teach women to pay attention to is that we have a normal bodily fluid called cervical fluid or cervical mucus. And throughout the cycle, your body will produce the cervical fluid, which you can pay attention to just by every time you use the bathroom. You can wipe and pay attention before you throw that toilet tissue away. Is there any cervical mucus present and what is it like? And what cycling women will notice is that near the middle of your cycle, near the time of ovulation, your cervical fluid will change in consistency to be more clear in color, more stretchy, more slippery feeling. And that's a sign to know that you are in this ovulation time period.
I see. And that's something that girls need to know pretty early on. I guess I'm surprised that it's not something that we talk about on a regular basis. Like, kind of, women's health is something that we really don't talk about enough. I mean, women, we do kind of one-on-one, but when it comes to our overall health, obviously, with our younger daughters, and when I was young, we never really talked about it. And even as we get older, women, our bodies are forever changing, right?
Yes.
And so, like, the conversation really needs to start when we're young and continue throughout.
Definitely.
So, why is it really important, though? So for cycling women, they need to pay more attention to their body. But tell us a little bit more about, like, the importance of this. Like, what are the different reasons? Obviously, pregnancy, no pregnancy, but about what can these things tell about our overall health?
Yeah, that's a great question. And I'm so glad that you asked it. Because, yeah, even if family planning isn't on your mind, even for young girls that are just starting to cycle, knowing your time of ovulation is not just about knowing for planning for a pregnancy, but our female bodies were made to ovulate. And so if you're not ovulating, that can be a sign that something is off with your hormones. It's also helpful to identify when that time of ovulation is happening and when it's happening from cycle to cycle, because that time period is related to different hormone levels. And so the time period between having our period and that time of ovulation is really when our estrogen level is the highest. And so if there's a change from cycle to cycle in the number of days in between your period and ovulation, that can be a sign that something's off with your estrogen. Conversely, if there's a change from the time after ovulation to your next period coming, that is related to your progesterone levels. And so, if there's a change in the number of those days, that can be a sign that something's off with your progesterone. And those are two main female hormones that then have effects throughout the body.
Is this something that is typical, not typical, but more common than we think when it comes to younger girls? Because I'm thinking back to when I was in high school, and my girlfriends and I, we kind of talked about it, we have a period, kind of how young girls are. But I also remember having a friend who had really bad periods, very heavy, very painful. And I guess thinking about the estrogen progesterone balance, could that have been something that was going on?
Definitely. Definitely. Yep.
So again, something that seems natural, like she just had she got the unlucky ticket that she got the bad period, but obviously now we understand that there was something else going on.
Yes. Yes.
Mm.
And unfortunately, what I find and what women tell me is that they go to their physician with some kind of period issue and they are prescribed birth control. And birth control can definitely help the issue in that it stops the woman from having natural cycles. It shuts down our body's natural functioning so those symptoms go away. But if the woman would ever decide to come off of birth control, those symptoms could come right back because the birth control isn't actually fixing the hormone imbalance that's going on.
So then I guess that said, there is a way to possibly fix that naturally.
Yes, yes. And working with a holistic provider, someone like a naturopath, or there are physicians who are trained in some of these natural family planning, fertility awareness methods that can really work to support these kind of symptoms from a more natural standpoint.
Interesting. This is just one of those conversations that I truly wish I'd had when I was 15 instead of 50.
Mm-hmm.
So, but let's talk a little bit more about birth control, because we both know that it has its place. But like I was saying to you earlier, when I was 15 and I was having really bad painful periods, apparently I had a cyst or cysts, and so that was what they said. Here, this is what you have, so here's the birth control. So obviously there's a place. But let's talk a little bit more about birth control, good, bad, and different.
Yeah, yeah. So, birth control, the most popular form of it is the birth control pill still. And it's a combination of those hormones I mentioned, estrogen and a synthetic form of progesterone. And really, what birth control is doing is it's tricking your body into thinking it's already pregnant so that you're not ovulating. It works. That's its main mechanism, is stopping ovulation. But it also works a couple of other ways too. It actually impacts the cervical mucus, and it impacts the lining of the uterus as well. And with those actions, basically, it's making it so that the environment is not sperm friendly and not friendly, so that if you did ovulate, that an egg could develop there.
Interesting. Really haven't thought it through. So this way, what does it really do? I think we know it, if you go on birth control because, you want to avoid pregnancy. And I don't think any of us ever, maybe people do now, but I know I didn't ever question, how does this work?
Right. Right. Yeah.
Interesting.
It's not always fully explained like that. And, it is very interesting, for me as a pharmacist, thinking about how does this medication work and how do all the other medications work, for all other kind of conditions. And it really is very interesting to me that birth control is really the only medication that we prescribe to perfectly healthy people to shut down a body's natural functioning. Cycling is something natural, and we're stopping that process, versus other medications are generally prescribed when you have an illness, when you have a symptom, when you have a deficiency, to help your body get back to its more natural state.
Right. And more often than not, medications that we take are short term.
Yes.
Except for birth control.
Mm-hmm. Mm-hmm.
Because, I use myself as the guinea pig. I mean, I've started when I was 15.
Mm-hmm.
There was a period when after I got married that I went off birth control, and my husband and I considered having children. And, I kind of wonder if being on birth control for so long really was the challenge.
Yeah, there is research, there is evidence out there that shows that birth control can definitely affect future fertility and definitely cause delays in fertility and even just delays in having regular cycles going forward. Some women get off of birth control and they don't even have a period again for months.
It's funny. Most of the time when you think of girls not having a period, it's, you think of the gymnasts when they were young and, how thin they are and how much exercise that they're doing. But you don't really think of that for other women who are other girls who aren't in that situation.
Mm-hmm.
So it's really, it really is an individual thing on the one hand, but at the same time, our bodies, as different as we are, they're pretty similar.
Right, right. Yeah.
So when you have a new client, why do they come to you, and what's the conversation?
Yeah. Um, a lot of women come to me because they are looking for an alternative to birth control. So either they have some kind of religious reason where they would like to choose not to use birth control, or they've had some pretty bad side effects from birth control. They don't feel good on it. And so they're really looking to avoid pregnancy, but do so effectively and naturally.
Mm-hmm.
So then what that conversation looks like is exactly, what we talked about with identifying what are your body's natural fertility signs. So we talk about cervical mucus tracking as an option. We also talk about there's an at-home device where a woman can do a simple urine test at home and get a reading of her hormone levels to know where she's at near and at the time of ovulation, and be able to use that as an optional sign. And then really talking about, whenever we're talking about natural family planning, it's only going to be effective if you are able to keep track, if you're able to pay attention to those signs and keep track of them. And so that's why I love to present women options. These are the multiple different fertility signs your body gives you. Let's figure out what works best for you and your lifestyle and what you're motivated to keep track of. And then it's, how do you keep track of this information? And then once you have that information, knowing, okay, my plan is to avoid a pregnancy, so I'm going to avoid unprotected intercourse during this time period.
Mm-hmm. Well, that makes sense. Yeah, that definitely makes sense. What about those women who have those difficult periods that kind of get all of the effects, the migraines, the cramps, the back cramps, all of that?
Mm-hmm.
How can natural family planning help those people?
Yeah, definitely. natural family planning can really give a descriptive picture of what's going on besides just those outward symptoms. So by noticing when is my time of ovulation and what are the days looking like, in between my period and that time, using that information, and especially when you're keeping track of it from cycle after cycle, you can look back and see, okay, this was my normal pattern. Now my pattern is changing, and this is where I'm noticing I'm having more symptoms. This might mean that something's going on with my hormones. And again, giving more evidence that there's something more to look into.
Mm, I see. I see. Because I know for me, that was one of the things that I struggled with was headaches. I would get migraines. I would get horrible cramps. And at the time, now obviously we're going back quite a few years now, but it was the only option. It was like either you take this or you just deal with side effects
Mm-hmm.
or the effects.
Right.
Um, and I wish I'd had somebody else to talk to, because the way you put it, when it comes to looking at a person, looking at your body, in a holistic way, not just the few days of the pain and the actual menstrual cycle, there's a lot more going on that we don't understand. And
Mm-hmm.
truly, if it's just those couple of days, one, obviously, there could be something going on. I know for me, I had an ovarian cyst. um, the question I come up with now is, what caused that?
Mm-hmm.
And back then we didn't even think to ask. I didn't even think to ask. And
Yeah.
so when so it's very unnatural, I think, some of these conversations that we have with our doctors, especially for younger girls. And if the doctor is a man, and even if it's a woman, depending on the girl.
Mm-hmm.
So how do we start having these conversations? Because teenagers, I mean, like I said, I was 12. It's embarrassing. Oh, I don't know about that. How do we have these conversations with our daughters, our granddaughters, to help them see what is really going on without it being embarrassing and kind of like a taboo?
Yeah, definitely. I think it's so important that we are talking to girls about this. And this is actually one of the things that I love to do too. I'll go and speak to a group of teenage girls and just talk to them about our cycles and about how your period is not just this inconvenient bleed that happens every month. It's happening because you did ovulate and your body is shedding some of that excess lining and getting ready for the next cycle, and your hormones are working together in this natural pattern. And I think what's really important in these conversations, with our female friends or with girls, is that it is perfectly normal for us to feel differently during different parts of our cycle. That we're cyclical by nature, not just because of the hormones that change, but also our energy changes throughout our cycle too. It's all linked together. And so being able to keep track of your cycle, you can then link that to other parts of your life too. So you can start paying attention to, oh, when do I feel the best? Oh, yeah, that seems to be related to this part of my cycle. Or, oh, why am I feeling kind of isolating right now? Oh, yeah, I'm in this part of my cycle. That's a normal thing for me to be feeling right now. And just reminding ourselves that, we don't have to feel the same exactly every day, and using that as really a means of empowerment for girls.
Mhm. I love that. I absolutely love that. It's so funny. As you were talking about this, I was thinking about a friend of mine who I went to high school with. And she was one of those people, like, you could just tell by the look on her face that that day you needed to stay away from her for whatever reason. And so thinking, I knew, now I really understand that she was somewhere in her cycle
Mhm.
that just made her a little crazy that day.
And that's okay. It's okay to have an off day, and having that information of your cycle can help you realize, like, okay, I'm not crazy. Like, this is just something normal that's happening. And
Mhm. Yep. We've got a couple of comments over here. Let's just take a look and let's see. Oh, this one's interesting. Living Healthy List said, such a great conversation. Our young girls deserve more information and education regarding their bodies. Thank you, Emily. Actually, it looks like that was Debbie Cassidy. Hi, Debbie. Thank you for listening. So there's so much more information that I know you can share with us. And I know you have an awesome podcast. So I'd like you to tell us a little bit about the podcast, what you share there, and how people can find it.
Yeah. I love having the podcast. My podcast is called Wholly a Woman, and it's all about how can we celebrate our whole womanhood. So we talk a lot about natural family planning and being in touch with our cycles, but we also talk about just other natural approaches to health. How can we support our mental health, emotional health, physical health, all of it. Denise was on the podcast, and that was excellent. The podcast is available on major podcast players, so Apple Podcasts, Google Podcasts, or you can go to my website, nfppharmacist.com/podcasts. And on that page right there, it'll give you a direct link to listen.
Awesome. It's a great podcast. There's so much great information. And it was so fun being on your podcast. We had a great conversation, as always.
I really enjoyed the episode with you, and I really enjoy getting to meet other more naturally minded practitioners and having these conversations again, like really empowering women. And like you said with Living Healthy List, it's about having fun too and celebrating who we are as women.
Absolutely. I think we tend to take things so seriously, and you get to a stage in life where you kind of got to go, there's more to life than there's more to life.
Yeah.
And that fun piece, I think, is really important. And I think understanding your body can make that a lot easier, because then you're not stressed out about it all the time.
Yeah. If we don't know something, it tends to be scary, right?
Mm-hmm.
But if we have more information, then we can feel more confident in ourselves.
Absolutely. And that's really why I love doing the Wonder Series, because it's, those questions that, we've been wondering about. But like I said, maybe we're too embarrassed to ask them because, maybe we feel we should know the answer.
Mm-hmm.
And Googling things doesn't always help either.
Right.
So if you have any questions about your cycles, don't Google it. Connect with Dr. Emily. Emily, I know you have a wonderful, wonderful gift for our audience today. So I'd like you to tell us about that.
I do, yes. I have an on-demand workshop called Know Your Body with Natural Family Planning. And I'd love for anyone listening today to access that workshop. So all you need to do is go to workshop.nfppharmacist.com/LHL for Living Healthy List, and put in your information there, and you will get access to this free workshop where we'll talk more about what does natural family planning really mean, how you can really use it, all of your body's natural fertility signs. And there's time built in the workshop too for reflection and how does this really help me know my body better.
I love it. It's really, because it's on demand, it's really simple for people to start watching it and take some notes and, kind of start and stop with, I love the fact that it's one of those things that people could do on their own time.
Yeah.
So Emily, thank you. I appreciate that. In the last couple of minutes that we have, what is, I think, the first tip? What is, kind of last before we head out? What's one last thing that you would want people to know about natural family planning, their cycle? What's something that we haven't touched on that you want to quickly tell us about?
Yeah, I think the one thing I want to leave those listening with is, for the female audience, is that you have options when it comes to women's health. You have options when it comes to avoiding pregnancy, achieving pregnancy, or for managing any sort of symptoms that are related to your cycle. And so I just really encourage you to be an advocate for your health. If someone tells you this is the only option, ask if that's really true, or seek out some alternatives so that you are really making an informed decision about your health.
Perfect. That is a perfect thing to leave us with, Emily. Dr. Emily, thank you so much for being here, for giving us this great information. And for those of you who are listening, and those of you who are catching us on the replay, don't forget to check out the workshop at workshop.nfppharmacist.com/LHL. Everyone, have a great week. Emily, again, thank you for being with us. We will see you here next week on Wonder Series Wednesday. Until then, I will leave you with this: healthy living, happy life. Thanks, everyone.
Thank you. Bye.